Welcome to the webinar series for the Violence Risk Assessment Cadre. This webinar introduces the concept of risk assessment and provides an overview of the different areas and instruments. Please read the accompanying materials because they will supplement and expand the content of this webinar. The goal of this online session is to acquaint you with the rudiments of risk assessment, but it is not a substitute for in-person trainings that will give you nuanced information on this topic. In modern times, violence is one of the leading causes of injury or death worldwide, even in developed countries not afflicted by wars or civil conflict. Clinicians play a key role in assessing the risk of violence because of their advanced knowledge of human behavior. Violence risk assessment involves ethical and legal considerations for clinicians who are asked to assess risk in a variety of circumstances, such as determining if the client poses a threat to a third party which carries an obligation to warn and protect that party, determining whether civil commitment is warranted, performing a pre-sentencing evaluation and informing the courts about the level of treatment necessary, determining level of custody and treatment progress when clients are hospitalized or incarcerated, informing a discharge or release of a civilly committed individual or an incarcerated offender, working as a consultant for an organization interested in assessing risk of violence. There may be other situations in which a clinician is requested to assess risk. However, the basics of conducting high-quality risk assessments are roughly the same for all scenarios. The starting point for assessing risk is science. Specifically, researchers have studied what leads humans to commit violent acts and how accurate clinicians are at predicting who those individuals may be. While researchers were able to find consistent risk factors for violence, the ability for clinicians to make determinations about risk using their judgment alone was rather poor. Understandably, these errors in judgment may pose problems. Being inaccurate and overestimating risk may result in longer sentences or prolonged periods of commitment, which would violate the individual's rights and liberties. On the other hand, being inaccurate and underestimating risk may lead to situations in which the individual can become violent. Either way, inaccurate estimations of risk may result in bad outcomes. Fortunately, research indicates that clinicians' estimation accuracy increases 70 to 80% when they structure their opinions around scientific knowledge. Knowing preliminary prevalence rates of violent behavior in groups similar to your evaluee will anchor a risk assessment. This rate is one factor to consider when you attempt to estimate your client's probability of future violence. Prevalence rates and probabilities vary depending on the context in which the violent behavior occurs. Adding to the difficulty of prediction are the ways populations differ in their predisposing factors for violence. For example, for some populations, substance use may increase the likelihood of future violence, while for other populations, it may not influence the occurrence of violence as much. Many individuals have risk factors unique to them, such as particular triggers, predispositions, or influences that should be taken under careful consideration because they may increase the likelihood of violent behavior. For example, a psychiatric patient with an extensive history of inpatient violence, chronic psychosis, and severe cognitive decline experiences multiple delusions. However, a behavioral functional analysis reveals that he mostly behaves violently when he reports being the reincarnation of one of the German leaders during World War II. Given his cognitive decline, he may not be able to elaborate why being a German leader leads him to attack others without any warning. In this case, any increased interest regarding World War II should be considered a warning or precursor of psychiatric decompensation and potential violence. Such an interest may be rather irrelevant in other patients. Thus, assessing risk not only entails knowledge of group data, namely the characteristics of other individuals who have also engaged in particular forms of violence in a similar context, but also knowledge about the specific factors that lead a particular individual to engage in violent behavior. The accumulated knowledge of group and subject-specific risk factors for violence has culminated in the creation of various risk assessment tools or instruments. These instruments structure and guide the way practitioners assess the factors most closely associated with violent behavior and conceptualized risk. The ultimate goal of these tools is to assist the practitioner in developing a violence prevention management plan that is matched to the evaluee's overall risk and context. Clinicians who aid their estimations of risk with these tools are much more accurate and efficient than those who attempt to estimate dangerousness based solely on their clinical judgment. Generally, there are two kinds of risk assessment tools based on the type of predisposing risk factors they consider: actuarial or structured professional judgment, which is often referred to by the initials SPJ. Actuarial instruments are structured around static risk factors, which are unchangeable and have a fixed contribution to violence prediction. Their presence typically increases the probability for violence. For example, the number and types of past crimes, or age at first crime. Actuarial risk assessment instruments offer an algorithmic method to estimate the probability of future violence by including and mathematically weighing risk factors for violence. In contrast to actuarial measures, SPJ-style tools provide a structure to arrive at evidence-based judgments of risk without relying on numeric or algorithmic methodologies. Judgments are made by appraising the relevance of both static risk factors and evidence-based dynamic or changeable risk factors, which may either precede violence or lessen the likelihood of violence in a given case. For example, level of family support, availability of weapons, and employment or school engagement. After careful consideration of these factors, evaluators categorize individuals as high, moderate, or low risk for violence and describe potential risk mitigation strategies. Both types of instruments have yielded reliable and valid estimations of risk and are often used in combination. One provides probabilities of an event occurring, and the other guides the clinician conceptualizing the scenarios in which those probabilities may become a reality. Before using any instrument, it is recommended that the user becomes familiar with the scientific literature and selects the instrument that is appropriate to the specific risk. Furthermore, most of the risk assessment instruments typically require the user to undergo training, and while not many do so, some require the user to possess specific qualifications or at least utilize the supervision of a qualified user. In the next slides, we will present different risk assessment instruments that are commonly used based on the context and type of violence assessed. However, there are many other instruments you can use. This is not an exhaustive list, nor is it a list of recommended instruments. That is, we do not endorse any of the instruments on this webinar. Rather, we just show some strong exemplars. The assessment of physical violence risk is perhaps the most common request for clinicians. You may be asked to evaluate the likelihood of violence risk for an individual with a history of physical violence. The underlying assumption behind this type of risk assessment instrument is that violence is the product of situations or poorly managed predisposing factors for violence. For example, untreated substance abuse disorder. Less often, a clinician may be asked to evaluate the risk of an individual engaging in predatory or targeted violence. That is, the likelihood that an individual attacks an identifiable target. This is generally called threat assessment and follows a different process and rationale. Among the most commonly used risk assessment instruments for physical violence are the Violence Risk Appraisal Guide, or VRA, an actuarial instrument that relies on static risk factors to draw probabilities of risk within the next 7 and 10 years, the Historical, Clinical, and Risk Management 20, or HCR 20 version 3, an SPJ instrument that relies on static and dynamic risk factors to structure the practitioner's assessment and management of risk, and the Violence Risk Scale, or VRS, another SPJ instrument which relies on different static and dynamic risk factors to yield different estimations of risk, low, moderate, or high. Risk assessments for sexual violence are also fairly common and roughly organized around the assessment of antisociality and sexual deviance. The most common instruments are typically for adult populations of individuals convicted of a sexual offense and are used to estimate the likelihood that an individual recidivates. Instruments to assess the risk for youth populations convicted of a sexual offense are less prevalent but frequently used as well. Recently, researchers have developed instruments specially designed for those offenders who perpetrate online sexual offenses, such as child pornography. New technologies are creating avenues for sexual exploitation of vulnerable individuals, and any new risk assessment instruments should help the assessor identify 1. Which individuals will persist in consuming and producing such online materials, and 2. Which individuals may transition from online to offline sexual offenses. Specialized training on these types of assessments is strongly recommended as they become more available. Among the most common instruments for sexual violence are the static 99R, an actuarial risk assessment instrument that assesses the likelihood an offender recidivates over the course of 5 or 10 years. The Stable 2007 is an SPJ instrument designed to capture the historical and dynamic factors that may contribute to future reoffending. Based on the final score on this instrument, the offenders may be classified as low, moderate, or high risk for reoffending. This instrument is commonly used in combination with the static 99R. The Violence Risk Scale Sexual Offender version is a more recently developed SPJ tool, and like the Stable 2007, captures static and dynamic risk factors that contribute to future reoffending. Partner violence is one of the most widespread violent phenomena affecting the lives of women and children around the globe. The goal of risk assessment instruments for partner violence has been widely debated, with some professionals arguing that risk instruments should be used to predict reoffending, and other professionals arguing that the focus should be to prevent violence from occurring. The choice of the risk assessment must then match its intended use. The Ontario Domestic Assault Risk Assessment, or ODARA, is a commonly used actuarial instrument that assesses how likely an individual is to assault their partner again and how their risk compares with that of other offenders. The Spousal Assault Risk Assessment, or SARA, is an SPJ instrument that guides the evaluator in considering the presence or absence of individual risk factors for partner violence in order to make a judgment of risk. This instrument may be cumbersome for non-clinicians to administer due to the need to assess constructs such as personality disorder or mental illness. Thus, non-clinicians may be better served by the Brief Spousal Assault Form for the Evaluation of Risk, or B-SAFER, which is the shorter version of the SARA. The danger assessment helps to determine the level of danger an abused woman has of being killed by her intimate partner. Thus, This instrument should only be used when the evaluator's intention is to assess homicidal risk rather than recidivism. Stalking is one of the most complex phenomena to assess. Most assessments focus on predicting a form of violence that can be easily separated in episodes, such as assaults. Nonetheless, stalking comprises a continuum of intrusive, unwanted behavior that may affect multiple targets over time and lead to other forms of violence. Thus, the assessment of stalking requires the evaluator to answer these questions when beginning a risk assessment. Number 1. Is it the goal to assess the likelihood that an individual stalks the same victim again? Number 2. Is it the goal to assess the possibility that the individual stalks a different target? Number 3. Is it the goal to assess whether the stalker not only targets their current victim, but also other third parties? Number 4. Is it the goal to assess whether stalking may transition to physical violence? The Stalking Assessment and Management, or SAM, and the Stalking Risk Profile, or SRP, may assist in answering any of these questions. The SAM is an SPJ instrument that can be used to assess stalking towards different individuals, including intimate partners. The most interesting aspect of this instrument is that it considers both the risk factors of the perpetrator and the vulnerability of the target. Thus, it is an instrument that allows the clinician to design effective management plans to prevent stalking and/or violence from occurring. The Stalking Risk Profile, or SRP, is an SPJ tool that enables the assessor to consider the separate risk domains of persistence, recurrence, and psychosocial damage of stalking, as well as the possibility that stalking behavior leads to violence. The Screening Assessment for Stalking and Harassment, or SASH, is a simpler version of the SRP and is intended to be used as a decision-making aid for police, health professionals, security organizations, and other professionals who are dealing with stalking situations. If an individual scores as moderate or high on this instrument, a more comprehensive assessment of the SRP is warranted. We recommend the evaluators to choose the instrument based on the goals and needs of their assessment. Youth violence risk assessment tools have been designed to evaluate adolescents from age 12 to 18. Unlike the assessment of adults, the validity or accuracy of the results of the youth risk assessment is particularly short-lasting. First, youth are in the middle of continuous developmental changes. Consequently, relevant risk factors at one point in time may not be valid later on. Further, antisocial behaviors are somewhat normative during adolescence, and 90% of youth who display criminal behavior during adolescence do not do so when they mature and reach adulthood. Given developmental considerations, evaluators should consider two aspects when assessing a youth's risk of violence. Number 1, whether the assessed behaviors are normal or abnormal from a developmental standpoint, and number 2, whether the youth is likely to continue with delinquent behavior during adulthood. Thus, risk assessments with youth tend to incorporate information on their particular developmental needs, risk factors, and response to interventions. The most common risk assessment instruments that guide the professional's assessment and management of risk with youth are the Structured Assessment of Violence Risk in Youth, or SAVRI, and the Youth Level of Service Case Management Inventory, or YLS-CMI. The SAVRI is composed of 3 risk domains that are relevant to adolescent development, as well as the particularities of violence and aggression in youth. One of the strengths of this instrument is the weight given to protective factors when making risk considerations. We caution the evaluator not to use this instrument with children under 12, given that it is specific for adolescents. Using this instrument with the wrong population may yield inaccurate estimations of risk. Following the risk-need responsivity model of offender rehabilitation, the YLS-CMI guides the evaluator in the assessment of risk factors empirically associated with youth recidivism while also considering the offender's strengths and their response to supervision. Threat assessment is a form of risk assessment that focuses on the prevention of targeted violence. Targeted violence is a type of violence that is predatory and intentional. That is, it is aimed towards pre-selected targets and predated by behaviors suggesting violent intent. Examples of targeted violence are terrorist attacks, school shootings, stalking of public figures, and workplace violence. Given that acts of targeted violence are very infrequent, they are mathematically impossible to predict. Thus, the goal of threat assessment is not prediction, but prevention. Evaluators aim at detecting individuals with the potential to act violently and then intervening so they do not become violent. There are only a few risk assessment instruments tailored to assess targeted violence. The most well-known are those that assess the likelihood of future workplace violence. Workplace violence risk assessments mostly focus on the prediction and prevention of future physical violence. Within this context, two instruments have shown promise of becoming accurate forecasters of behavior. The Workplace Assessment of Violence Risk 21, or Waiver 21 version 3, is an SPJ instrument that structures the assessment of workplace targeted violence risk. This instrument encompasses general risk factors for violence and targeted workplace violence risk factors, including homicidal ideas, violent fantasies, expressed threats, weapon skill and access, and pre-attack planning. The Kaywood Assessment and Response Grids, or CARGs, is a tool specifically designed to organize the assessment of individuals at risk for physical workplace violence and foster decision-making about other forms of workplace aggression, for example, harassment, stalking, or bullying. It also includes general factors for violence as well as predictors for targeted violence. Last, the Risk Assessment Guideline Elements for Violence, or RAGE-V, while not a risk instrument, is a guideline that aims to assist assessors and organizations in considering the factors and steps necessary to provide opinions concerning the potential risk of future physical violence from a known individual. In sum, we have presented a short overview of the violence risk assessment process and instruments. The major takeaway points of this webinar are: first, clinicians are frequently required to assess risk of violence. Second, clinicians should not rely solely on their clinical judgment or experience to evaluate violence risk. Using tools specifically designed for evaluation of violence risk significantly increases the accuracy of the assessment. Third, there are different approaches to assess risk and different instruments clinicians may use. These approaches and instruments can be dichotomized into actuarial and SPJ. Fourth, given the variability of assessments and instruments, clinicians need to become familiar with the literature, purpose, and applicability of each of these instruments.